Hello, everybody. Dr. Jenkins again, here to talk about innovation, leadership, and professional governance. We're building the structure for transformation. This is all about this discussion about making sure that you have the proper structure in place for making change, is basically what we're going to talk about. Oliver Wendell Holmes stated that man's mind stretched to a new idea never returns to the original dimensions. So once you make a change, it should be very hard to go back. So let's get started. When this whole chapter, like I said, is about innovation. And we see a lot of changes in healthcare these days that are building on the path of innovation. We've seen it in patient care delivery, technology, and through business models. All three of these large categories are the reason why change is occurring and will continue to change. We've seen less invasive types of procedures. We've seen new pharmaceuticals. We've seen more development with provider access to their care, knowing more about their choices with healthcare. Those are just some of the examples, and we're just going to continue to see more. So that's why we need to discuss this topic. So the things we're going to talk about is some definitions and concepts, why innovation is important, and then strategies to integrate and advance innovation. As you might have seen in some of your institutions, you've seen examples of leadership titles that I've listed here. And actually, there's more in your book. But we're starting to see more and more of these titles that should be in charge of innovation and therefore change. So what's the difference between innovation leadership and a project manager? Well, the main difference is that the innovation leadership is about looking to the leader and developing the work, how the work is done and how it should be approached. Whereas the project manager takes that information and manages the process to facilitate the change. So the innovation leader, it has an overall picture, and then the project manager is just guiding that transformation. So what's the relationship between innovation, evidence, and practice dynamic? Innovation and evidence and practice are really intertwined together. You cannot have one in this changing healthcare system without the other. You have to have ideas about how things can be better. You have to know where to find the evidence to support the change, innovation, and then have all the backed up systems related to practice that are needed to change and to deliver the innovation. The cyberkinetic interface of evidence and innovation is a lot. It's complexity when you first know about it, but it's the interrelationship between knowledge creation and research, practice, expertise, clinical values, and the culture of care. Anytime that you see a gap in one of these areas or you find a gap, in these areas, then that's a chance for innovation to occur. It's going to enhance maybe knowledge creation and research. It might advance knowledge creation and research. It might advance clinical practice, clinical values. All of these things are interrelated and it's cyclical. So you always find that once you determine a change, then you have to go back and review again the knowledge that you've learned and what do we need more of. Then what you need to look at, how are you going to measure that change occurred? And you've all heard about benchmarks, and that's what we generally look for. But you need, as an innovative leader, to develop how to quantify the data to show that changes occur or what needs to be done in order to advance the change. So what barriers do we have to effective innovation? Well, sometimes during change, we find that the model is flawed. For some unknown reason, it's flawed. That should stop the process right there and see what needs to be done in order to facilitate the changes. Subjective measures are excluded, and sometimes we have to know the feelings of others, which is subjective. What people understand about the change, what do they want about the change, what do they feel is disrupting the change. A good leader and people that are innovative are always looking for ways to gather data, called data mining, and then how to analyze that data. There's all sorts of information out there through spreadsheets, all of that, whether it's in an institution or in a big database that's available through a lot of resources. And how do you look at that information and how can you analyze it to make appropriate for use in your particular area or institution? You cannot have innovation technology that replaces analysis and judgment. There still has to be some type of judgment. It's as simple as whenever you have to make some kind of calculation with a medication so that you know the correct dose to give. You have to know what's a reasonable answer. So you're using your judgment to analyze how you did your math to provide the correct dose of that medication. It's just that simple. And then you always have, as an innovative leader, always have to ask the right question. You need to always step back and see if the right question is being asked and is it being measured. So some course corrections as we move through the process of change and innovation is disenchantment, discontinuation. Well, what does that mean? Maybe the change isn't what you expected, and so you're disenchanted, not happy with the direction of the change. So you find an acceptable way to make a course correction so that the change can occur that's the best or optimal change. Replacement discontinuance means that you found a better idea to make the change, and so you replace that with the original idea. So if you look at innovation strategies, what it is just basically relying on information and measurement in order to ensure that change occurs. So I hope you learned something from today, and we'll talk soon. Thanks for listening.